A cancer diagnosis can certainly be devastating, and trying to make a treatment plan, it can get very confusing for you and your entire family. Dr. John Kressel of Phoenix Cyberknife Center, he is here to tell us how their unique treatment is giving patients new hope. Great to see you. Happy New Year.
Happy New Year
to you. So what is Cyberknife?
So Cyberknife is the latest form or the most advanced form of radiation therapy for treatment of a number of things, but mostly cancer patients.
And so what is it exactly? What is it called if you were in a doctor's office and you wanted to talk about this alternative treatment?
Right, so standard radiation therapy, this form is radiosurgery. So it's the only form of treatment where the actual radiation treatment is moving with the patient, and that increased accuracy is what it's all about.
And that's revolutionary.
It's the only device that does that.
And so for patients out there who are watching this morning who maybe have been given a cancer diagnosis, you guys are unique not only here to Phoenix but across the country. Why is that, and how, and what are you doing that's so unique?
Well, we've got two treatment devices side by side that actually are specialized for doing radiosurgery. So it's the only place really that allows us to provide whatever treatment is best for the patient. We don't have to compromise. We don't have to send them anywhere else. You can, kind of get your entire treatment options for any type of radiation therapy, but most importantly, radiosurgery at our place.
And so many people, I'm sure you hear them in your office, who say, you know what, I don't want to be cut on. I don't want to have surgery, a drastic surgery. Are there side effects with this?
Well, sure, there's side effects with any treatment, but obviously the biggest difference is that, there's no cutting, there's no incision when it's an alternative to surgery. When it's an alternative to just standard, common radiation therapy, it's more convenient. Usually treatments are only 5 days or less versus 9 weeks or more. The side effects many times are also less because that accuracy and precision allows us to treat less normal tissue, so less side effects.
There you go, and it seems like it's so precise that would, of course, give people who are watching, you're not going to hurt the other tissue around the area that you're focused on.
Many times that's an improvement over the standard ordinary radiation therapy, and downtime or recovery is minimal. Most patients continue to do their normal activities. There's many gentlemen who are hard laborers, construction workers. We treat them during their noon hour, and they continue working throughout the entire treatment.
Yeah, we've heard folks that on this show who said, I was back on the golf course by the afternoon. Why don't we hear more about this?
Well, it's real. There's not that many Cyberknives in the country. I believe there's about 150 now, but there's more and more coming. So it is a newer treatment, and that's part of our mission is to educate the public and educate physicians. The biggest stumbling block we have is physicians who aren't trained in it, don't really know much about it, and are telling their patients, "Oh, it's not for you." Well, they really need to go find all of their treatment options, get second opinions, and talk to somebody who's actually trained in it.
And will insurance cover this?
Yes, it's covered by Medicare. It's covered by the major insurance carriers. So it's something that's very well accepted. It's actually one of the most rapidly growing forms of radiation therapy for a number of different cancers in the United States.
And I know you touched on it briefly at the top of this segment. What type of cancer does it treat? Well,
basically from head to toe. But the most common sites, are brain, breast, lung, prostate, liver, esophagus, so head and neck. So it's pretty much all cancers, not only early stage, but many times even advanced cancers that have moved throughout the body. We can help with this treatment.
And coming up, Dr. Kressel, one of his patients who had prostate cancer, you're going to hear his remarkable story a little later in this program. Well, if you have any questions for Phoenix Cyberknife Radiation Oncology Center, you can email them at info@pcroc.com. They're located at 4611 East Shea Boulevard in Phoenix. 602-497-0605 is the number to call. They're also online, phoenixcyberknifecenter.com.